Alrighty, well, thank you again for joining us this morning for our record keeping in the CACFP training. We're going to get started with some CACFP 101 and record keeping. We're going to start talking about income eligibility forms and records of meals served. So this list is the variety of programs that the CACFP is able to operate in. One of the most common ones is childcare centers, but we are also in family childcare homes, adult daycare programs, Head Start and early Head Start programs, homeless and emergency shelters, outside school hours programs, at-risk after-school programs, and in school districts, or as we like to call them, school food authorities. CACFP is a USDA program here in Colorado. It's administered by the Department of Public Health and Environment. It is a reimbursement program. So we will reimburse you based on the claims that you submit for the creditable meals that you serve. All CACFP reimbursement is required to be used for food and food service operation. This can include staff that have CACFP duties and non-food supplies like plates and cups. All programs operating CACFP must operate a nonprofit meal service, which means that all reimbursement goes directly back into the food program to increase the quality of the food served, pay wages for staff, etc. Again, the focus.
Yeah, I think I'm. Yo, what do you know? I can't see nobody.
Oh, let's see. Somebody unmuted themselves. Let me make. Shoot. How do I mute them? Okay, I can't hear them anymore. Oh, maybe they're there. Hold on. Okay, it sounds quiet again. Sorry about that. Again, the focus of this program is focusing on quality, nutritious meals and snacks for participants of all ages. Okay, so as I'm sure you are all aware, there is lots of record keeping and documentation required in CACFP. All records must be kept for 3 years plus the current fiscal year, including all of the records on this slide: menus, production records, receipts, training records, income eligibility forms, records of meals served, enrollment forms, attendance records, your code of conduct form, and any of your claim information. Some of the requirements for the income eligibility form include sharing the income eligibility form letter with families. All participants are required to have a new IEF every 12 months. All information must be complete on the form before it is signed by the institution. There is no whiteout or pencil allowed. This is a federal legal form, so it needs to be treated as such, and confidentiality. Okay, you guys hear me? Okay, good. All right. Confidentially is required because families are providing some of their personal information and it needs to stay confidential. A current, correct, and valid IEF is needed to claim any participant in the free or reduced category. If a form is incomplete, they must be claimed in the paid category. A helpful way to think of it is all children or adults need to be claimed as paid unless you have adequate documentation to claim them otherwise. And reimbursement is based on accurate and complete income eligibility forms.
Natalie,
Yes.
can we pause quick? We're having issues muting people, so if everyone could please mute themselves, specifically Teresa and Deidre. When I hit mute all, it's muting Natalie, but it's not muting participants. And I don't know where the function is, like it's not letting me mute people,
Okay,
Natalie.
perfect. Thank you. I think that might have helped. Okay. I think we're good. Okay, awesome. Thanks, Chrissy. Yeah, I wasn't sure if like only I was hearing background noise, but I think we're good now. Okay, so new income eligibility forms are released every year. Typically in the summer is when they're updated. And this is because USDA releases the household income guidelines every summer. And then that's just a really great way to, make sure that all of your participants have the most updated form, and are determined with updated information. You only need one form per household. So if there's siblings attending your center, they just need one form. If there is enough room to put all of the names on the form, you can always attach a second form. Our team has forms available in English, Spanish, Somali, Russian, and Arabic. And links to all of those are going to get dropped in the chat. And then USDA also has the forms and it's translated into 34 languages, including Chinese, Farsi, French, Korean, Portuguese, Tagalog, Ukraine, and Vietnamese. So lots of resources out there for the families participating. All right, so we are going to walk through the steps of how to complete and determine an income eligibility form. Step 1 requires the family to list the children's first and last name. The records of meals served should have the same name listed on them. So no nicknames on the ROMs. The ROMs should match the full name on the IF. This enrollment section is new this year. Over the last couple years, licensing regulations and our regulations are no longer aligned as they previously were, where CACFP could accept the enrollment information that licensing did. So we went ahead and added it to our income form as a way to save some paperwork for you all. If you do not collect IEFs because of the program that you're operating, for example, if you're at risk and you have different eligibility, we have multiple ways to collect this information, and we'll talk about that in a little bit in this presentation. So the two pieces of information that are required to be collected for enrollment are the normal days and hours in care and the normal meals and snacks received. All right, and then there are some boxes to the right here that allows children to be determined automatically. So the first one is foster children.
I'm sorry, can I interrupt for a second?
Yes, of course.
So, I have a question about the normal hours.
Sure.
Some kids are here just before and after school, and then on off days they're here for all meals,
Okay.
breakfast, lunch, and after. So how do we handle that?
Sure, that's a great question. I would say whatever they are attending most frequently. So the after school, I would have you recommend to the families to choose those. And then, because that's the more common one. Does that answer your question?
Yes, thank you very much.
You're welcome. Alrighty. Foster children are eligible to automatically be claimed for free meals. Institutions do need to obtain documentation verifying that the child is in foster care and maintain that documentation. The foster child is to be included in the total number of household members. The automatic eligibility does not extend to other children in the family, only the children that are in foster care. The other children will be determined based on the income or case numbers listed in the IEF, just as you would for any other child. Any questions about foster children? Okay. All right. And then there is also, oh,
Again,
yes.
it's me again. Sorry, I just had a hard time unmuting.
You're fine.
My name is Dania, by the way.
Hi, Danielle.
How about kinship?
I believe that would fall under this same
Okay.
category. I'm looking here. Yeah, because that's like
What's that we yeah.
temporary guardianship.
Yeah.
Yeah.
It's foster, but it's going to a family instead of out. Yeah.
Like,
Okay,
okay,
perfect. Thank
okay.
you.
Yep.
Perfect. Thank you.
You're welcome. Alrighty. If a child is considered homeless, migrant, or runaway, the child is also automatically eligible for free meals. Again, the institution must obtain documentation verifying the status of this child. This may include a letter from the director of a homeless shelter, a migrant education program coordinator, or a letter from a official that works with the runaway and homeless youth programs. And then the final automatic eligibility box is Head Start children. These children go through an additional income verification, which is more strict than ours. So if they qualify for Head Start, they automatically qualify for free meals with us. These children do need to be listed on a Head Start list that is signed by a Head Start official every month. The Head Start is the Head Start official is whoever is doing that income verification. Sometimes it's the director of the center itself. Sometimes it's with someone that works in the county. So it's whoever you get your Head Start information from, that is who needs to sign the Head Start list every month. And we will check that when we come for a review. All right, step 2 on the income eligibility form is case numbers. This is where families can list a case number for SNAP, TANF, or FDPIR, which again will give them automatic qualification for free meals. SNAP and TANF have the same case number requirements. It is a 7-digit alphanumeric, which means numbers and letters, and it usually starts with 1B. And then an FDPIR number is either 5 or 9 alphanumeric digits. And as a reminder, CCAP, or the Colorado Child Care Assistance Program, is not a case number that qualifies for free meals. So if you see a Medicaid number on a child income eligibility form, or if there is a CCAP number listed here, that does not automatically qualify them. They would need to be verified in another way. All right, so then step 3 is where families can list their income. If they've listed a valid case number in step 2, they can skip this section. If not, this section needs to be complete. So section A in step 3 is where the child income can be listed. And section B is where all other household members and income is listed. And we're going to walk through all of this step by step. So the child income needs to have the income and the income frequency listed. And on this slide, I also have an example of different income sources that would be allowed in this section. This same chart is on page 2 of the IEF. So if families are ever unsure if income they have would qualify as child income, this chart is on the back that they could reference. And then section B is all of the other household members. So the first box in this section is to list the first and last names of anyone else living in the household, regardless of if they have income or not. Income should be listed before any taxes or deductions. Families can decline to provide their income. They could either write over income, do not wish to disclose, and these participants will then be claimed in the paid category. Income is not required with a valid case number in step 2. If an income section is blank, this is not considered that the family has zero income. Blank is considered empty and incomplete. Therefore, the participants must be claimed in the paid category if they do not write any income. And then the next section is where families will list their earnings from work or other sources. So the first box is earnings from work. Again, there is a chart here with examples of what that income might look like. The next section is welfare, child support, and alimony. Again, there's a chart with additional examples. And then finally, pensions, retirement, Social Security, or VA benefits. Again, a list of examples. One of the most important pieces when families document their income is to list the, oh, do you have someone with a hand raised? Do you have a question?
Yes, my name is Jada.
Hi,
How's everybody
Jada.
doing? I'm fine. I was just wondering because you said that they can wish to not fill out
Mhm.
the income portion of it. Does that automatically mean that they are not eligible for free meals, or what does that determine for us?
Yeah, that's a great question. So if the family chooses to not list income and they don't have a case number listed in step 2, they would be claimed in the paid category.
Okay, thank you.
You are so welcome.
Therapist
If they refuse to fill out one, that would also be the paid categories, right?
Yes, ma'am.
Okay, perfect.
Yep. Yep. This is kind of where the little reminder I shared earlier comes in is basically everyone is paid unless they have a complete form that qualifies them otherwise. So if that kind of helps, if there's no income listed, it's paid. If you've given the family 10 forms and none of them have been returned, because that happens, they're claimed as paid. So paid is default unless you have a form showing otherwise.
I have a question about that.
Yes.
How would we document that we don't have a form from the family?
As long as you're claiming them as paid, it would be
Okay.
fine if you just don't have anything for them.
Got it. Thank you.
You're welcome. Any other questions? I'll give you guys a minute in case you can't find your unmute button. Okay, alrighty, I'll keep going, but please keep the questions coming. They're very helpful. Alrighty, so the income frequency is very important because this is used to determine the total income the family has, and this will be needed to determine what rate they qualify for. So the options are yearly, monthly, bi-weekly, and weekly. So if a family fills out their income but doesn't list the frequency, you need to return the form to them before you sign it and have them add that information. Or you can call them on the phone and ask them, and you could add that as long as you date an initial, as long as you have not already signed the form. So again, any of these revisions will need to be done before you sign off on the form. Hourly rate is not one of the options because someone could make $20 an hour, but there's no way to show, do they work 20 hours a week, 40 hours a week, 60 hours a week? So that is not one of the options that they're able to list. The next section is the, oh, was there a question?
Алло,
Hello.
здравствуйте. Это Ганна?
Oh, I think maybe, oh, there we go. Okay, not a real question. Okay, so total household members. So this is the total number of children and adults listed on the form. So the very top section in step 1, all of the children and then all of the adults in section 3 need to be combined to have a total number. Sometimes we will see that families will write a number here, but that number does not match the names on the form. You will then have to ask the family to update it, either adding names or adjusting that number. So if a family writes 5 for the household member number, but there's 2 children listed and 2 adults, they would either need to add another name or they would need to update the number to 4. Any questions on household members? Okay. All right. And the final but most important element of this section is for the families to list the last 4 digits of their social security number or to check if they do not have a social security number. If this is blank and there is not a valid case number, the form must be claimed as paid. It is considered incomplete and invalid. And if these meals are claimed in the free or reduced category, and we come out for a review, and there's no social security number listed, and there's no check in the no social security number box, every meal for every child that has that error has to get adjusted all the way back to the beginning of the fiscal year. So sometimes that can add up really fast, and it can be a lot of reimbursement funds that have to be paid back. So,
I have a question.
yes.
If there is a mistake on the form, does the entire form need to be changed, or can they draw a line through it and correct it that way?
It would depend on if you have signed off on the form. If you have not signed off on the form, they can just update it. And then, once it's complete, then you do your job, you look at it and sign off. If you have signed it, I would highly recommend just having them complete a new form. Or if you have them update, they could just cross it out with a single line, date and initial it. And then you would need to do the same if it changes anything on your determination. Does that
Natalie,
answer
I
your
have a
question?
question. Oh,
Oh, okay, great. Hi, Jackie.
hi, Natalie. Quick question. So
Yes.
from what if they do they need to put their social if they've put in their case number for SNAP benefits? Do
They
they
do
also
not.
need to put their social? Okay.
Nope.
Okay, I just wanted to confirm that. Thank you so
Yes,
much.
you're so welcome. Yes, if there is a valid case number for either SNAP, TANF, or FDPIR in section 2, this whole section 3 they can skip.
I have a question.
Yes.
What if a family has a one child enrolled and then they have another child during the fiscal year and they already filled out one? It doesn't change anything. They have a case number. Do they have to fill out a new form, or can they just add that child?
So if they are going to be enrolling the new baby and claiming meals, I would have them fill out a whole new form. If they're, if the baby is home or not in your center, you could always just keep that form until it expires and then have the family update it or, fill out a new one with the updated information.
Okay.
Does that make sense?
Yes, it does.
Okay, great.
Can you explain a little bit more about when and how crossouts are allowed?
Sure. So usually they're not. Whiteout is definitely not allowed. It's best if there is a error to have them fill out a whole new form. If it's something that doesn't change the eligibility, you could have them update it and just cross it out once and initial and date. But best practice would be to fill out a whole new form.
Okay, that is what we're currently doing. So thank you.
Okay, fabulous. Yeah, if it's something simple like the household members or something like that, that's fine. But if it's, they left the income section blank and you already signed off on it and they need to add it, like just have them do a whole new form. So let's see. There is not a specific form for homeless shelter. Sorry, just the chat box kind of just caught my eye there. Okay, I'm gonna keep going. Okay, so something that I recommend centers do is highlight this social security number section on the IEF so that not only does it catch the eye of the families filling out the form, but it also catches your eye before you sign off on it. So that's something that seems to be helpful to make sure that you're looking at that section before you sign off on it. Okay, we are going to do a little poll here. Let me see if I can get it to load and cooperate with me. All right, so everyone on the call should have this little poll box window that popped up. So if you all could just answer the poll, the question is, if 0 income is listed, the IEF may be determined as what? The choices are free, reduced, paid, not enough information, or you're just unsure. And I'll give you guys a couple more seconds to answer. Okay. Looks like most of you all answered. Okay, I'm going to end it and you all should see the results popping up. So most people selected free, which is correct. So if they do write the number 0 for their income, they may be determined as free. So the next question is the opposite. And I'm going to share that poll next, maybe, if it's going to work here. There we go. So if the income section is blank and there is no case number listed, the IEF must be determined as what? Free, reduced, paid, not enough information, or unsure. I'll give you guys a couple more seconds to get some more answers in here. Okay. All right, you should all see the results now. Most of you selected paid, which is correct. So if they write 0, the number 0, they may be determined as free because they're verifying that they have $0 for income. If it's blank, blank is considered empty and incomplete, and they must be claimed in the paid category. Any questions about those two examples? Okay.
I do have a question. I've had
Yes.
a family have a case number, but still write their income. Is that okay to just proceed with the case number, or do they need to fill out a new form?
No, they can, if they write both, that's fine. Because that's more information than you need, which is always okay. We just want not less.
Got it. Thank you.
You're welcome.
If they send in a form that says 0 income and you don't believe them, so do they get in trouble or do I get in trouble?
It would ultimately come down on them, because they are signing off on it. Actually, I think the next, hold on, So this is the section step 4. So this is where the parent or guardian, whoever's filling out the form, signs off on it. And it says, I certify that all information on this application is true, that all income is reported. I understand that this information is given in connection with the receipt of federal funds, and CACFP officials may verify the information. So ultimately, it's on them. If
Okay.
they sign it, it's on them. Great question. I've never had that question before, so good one. All right, I'm gonna go back because I skipped ahead a little. Okay, any other questions about zero income, blank income? Great. So let's see, we went over that. We just talked about this. So again, this is where the person filling out the form is certifying that it is accurate. When you review these forms, please make sure that it includes a date that the form was signed. So this is the income or the household income guidelines. This is what is updated and released every year. We have a link for the current ones to drop in the chat box for you all. And sometimes it seems like people don't always realize that there's columns for different income frequencies. So if the income listed is only listed as monthly income, you can use the monthly column. And we're going to go over some examples so you know that you're calculating their income correctly. Because again, if we come for a review and they're determined incorrectly because you didn't calculate it accurately, we would have to change the claims for the entire fiscal year for those. So converting income is really important. If multiple frequencies are listed, they will both need to be converted to a annual or yearly income, and we'll go over some examples for that. So again, only required when there's multiple income frequencies listed. So for example, if there's a weekly income and a monthly income, those will need to be converted before they're added together. And they would need to be converted to yearly. And the conversion factors for all of the different income frequencies are listed on this slide, but they're also listed on the back of the IEF that I'll show you in a moment. That way you don't always have to remember these. They're on the form there for you to reference. So if there's weekly income, it needs to be multiplied by 52. If there's monthly, it needs to be multiplied by 12. And if there's biweekly, it needs to be multiplied by 26. And I'm going to walk you through this example on biweekly income because a lot of times it's calculated incorrectly, and that could potentially result in not determining the IEF properly. So in this example, we have a household size of 5. One adult has $1,500 monthly income. Another adult has $1,200 biweekly. So on the left, we are going to take the $1,500 monthly and multiply that by 12, and that will give us $18,000 as a yearly income. Then we are going to incorrectly calculate. This is how we often see it. People will take the biweekly income and multiply it by 2, thinking that it gets them a monthly income. And then they will multiply that by 12 to get what they think is a yearly income. Sometimes I've also seen biweekly multiplied by 2, and then they stop, and then they will add that to the monthly, and that is also incorrect. So if we do this incorrect calculation, we come up with a yearly income of $46,800 for the household size of 5. So if we go to the right and we do it correctly, the blue numbers are correct. So 1,500 times 12 is 18,000. That is still correct. But we're going to do the biweekly income correctly this time. So we're going to multiply it by 26 And you'll see that it comes out to not only a different number, but a higher number. So it comes out to $31,200. And if we combine that with the 18,000, it comes up with a yearly total income of $49,200 for a household size of 5. So you can see that this is actually a pretty drastic difference. And in our next slide here, we are going to compare it to our household income guideline. And then I'm actually going to launch another poll for you all to see if you can determine how this income should correctly be determined on their form. So we will look at the number in yellow, the 49,200, the household size of 5, and let's see if we can figure out what the correct eligibility category is. All right, give you guys about 10 more seconds, get a couple more answers here. Jada, I'm not sure if I can resend it, but that's okay. Okay, gonna end this. No worries. Okay, so we're going to look here. So we will look at the household size of 5 all the way across, and then we will look at the 2 yearly columns. So the first is 47,554. So if we're looking at our correct calculation, it exceeds that. So then we will look at the reduced, and we will see that it says 67,000. So the correct calculation is in between the two, which means that the correct eligibility is in fact reduced, which 72% of you guys put in the poll. So that's fantastic. But you will see on here, with the incorrect calculation, they would have been determined as free. And then all of their meals would have been claimed incorrectly. And, that would be an overclaim that we would have to adjust all of your claims for the fiscal year. So that's why, we take the time to walk through examples like this to kind of show you that the impact it can have. Any questions on converting income? It can be kind of tricky. Okay. If any questions come up, let me know. So now we are working on the second page of the IEF. Step 5 is where the family will document the ethnic and racial identity of the child. It is the institutions are required to attempt to collect this information from families. Families are not required to provide the information, but you're required to try. If they leave it blank, you can ask them to fill it out. If they don't, that's fine. It can be left blank. The one thing that you cannot do is to use visual observation and fill it in yourself. So you cannot just guess and fill this out for the family. You could call them and ask, and if they give you the answer, you could fill it in if they tell you, but you cannot just guess what their race or ethnicity is. Any questions? Alrighty, so now this is where the institution will be determining the IEF. So in the very top right of this blue box is where you will see those conversion factors. So it says annual income conversion, weekly by 52, biweekly by 26, and monthly by 12. So that's what I mentioned earlier, that they're waiting right there on the form for you. You don't have to have that live in your memory. The household or the household last name is basically to help you with if you have an IEF, that's stapled together and the two pages get lost, to put those back together. So if a family has more than one last name, you can write both of them. That's totally fine. It's kind of however you need to make sure that the front and the back, or the page 1 and page 2, find their way back to each other. It is also your responsibility to ensure that all information is transferred from page 1 to page 2 to determine eligibility. A lot of times we see household size isn't always written on there. Eligibility category needs to be determined and selected. So it is the institution's responsibility to determine the form and to check the free, reduced, or paid box. Then you will sign it and you will date it and set the expiration date. There are 2 ways to set the expiration date. You may choose as long as the same method is used for all income eligibility forms. So you can't, go back and forth between the 2 methods at the same site. You have to pick one and stick with it. And the 2 options are using the month the parent or guardian signed the form, or the month that the determining official signed the form. Any questions on what your role and responsibility is with the IEF? Okay. So here is some tips for success, because the IEF can be a little daunting and complicated. So here are some helpful tricks. A lot of institutions that are successful maintain their IEFs in a 3-ring binder. This kind of helps keep them from falling out of folders. You're able to kind of keep them in a nice order. It's helpful if they're alphabetized, especially when we come for a review. It just makes it really helpful to not have to sift through a whole folder to find a particular child you're looking for. Sometimes people also separate in the binders by category. So they'll have all of their free together, all of their reduced together, and all of their paid together. And then since you do have to maintain the IEFs for 3 years plus the current fiscal year, sometimes it's also helpful to have those, children that are no longer attending, to have those IEFs for the same fiscal year in that binder. Because when we come for a review, we might be needing to look at an IEF for a child that no longer attends, but it should still be readily accessible for the fiscal year. Sometimes we recommend to use different color paper for each year. So say, for example, all of your fiscal year 25 IEFs are going to be pink. And then once summertime comes and the new household incomes are released, you are going to have everybody complete a new one, and you're going to use yellow paper. That will help you if you're, looking through your binder and you're like, oh, the Jones family, they still have a pink IEF. I don't have their new yellow one. And it's just kind of a visual way for it to catch your eye if something's expired. A lot of institutions will redo all of their IEFs every July or August. So an IEF expires after 12 months, but they can update it in between. So if you have a kiddo who starts in March, you could still ask the family to fill out a new form in August. so that all of your kiddos or most of your kiddos are at least on the same cycle, and you're not having to chase parents every single month for an updated form if they expire. So it kind of just helps the headache a little bit. They need to be kept in a locked area to maintain confidentiality. It does have to be distributed to all households. Again, you can control if the parents and families bring it back, but it is required to be distributed to all of them. And we do recommend printing them front and back. This not only saves paper, but it kind of helps, from losing the front and the page 1 and page 2. All right. Does anybody want to unmute or drop it in the chat box if they have any IEF success stories, organization tips, things that you've kind of learned the hard way that you would like to share with the group?
Hi, it's Danny again.
Hi.
Hi. The color, we've learned that like at the get-go, and that's just been so helpful. So every July, August, we just pass it out to everybody, just change colors. And that way we know that everybody has it, and we just know like all the colors have to be changed in that binder when we take out the old ones. And another one is we always include it in our for our new parents, we always include it in our enrollment packet, the paper, so that way we make sure everybody gets it too.
Fantastic. I love to hear that you're taking our recommendations and they're working for you. Wonderful. Anybody else have anything to share? Great. Chrissy is dropping some helpful resources in the chat box too. We have a cheat sheet that walks through all the different steps. It's a lot of what we already talked about today. It's very helpful for training new staff. Okay. So we are going to go through a learning activity together. I kind of had to reinvent the wheel a little on this from when we do this in person. So hopefully it goes smoothly. So I have 4 IEFs that I'm gonna put on the screen one at a time, and I'm gonna launch a poll for you all to answer based on what you see on the screen. So let me launch that, and then I'll walk through the IEF with you. Let's see, number 1. Oh, oops. Hold on. It says my other poll is still up. But where? Why won't it let me? Oh. Let's see. There we go. Figured it out. Okay, so the poll is just asking how this should be determined. So on this income form, so we have kiddo listed on here, Candy Cane, age 3. They have their enrollment information listed. There is no case number listed, which is fine. We will just go to step 3, look at the income that is listed, and based on what is on this form, how would you determine this? Yeah. Free, reduced, paid, not enough information, or unsure. Hi, puppy. All right, I'll give you about 10.
So
Oh,
yeah,
yes.
hi. So
Hi.
while we're waiting, I have a question.
Sure.
So I have a case, I've had a case before where I've had a family that has, I mean, a couple different times, where I've had a family that's over income and, but they have 2 children and one of them is Head Start. So what I've always done is the Head Start child would always be under the paid category, I mean, free category, right? And then the child that's over income, he would be probably the paid because they're over income.
Yes.
So then he would go in and do that. Okay. So kind of the same thing too. I mean, if we always, and sometimes we have parents that will become Head Start later. I mean, they might be a reduced category and then that child is on Head Start, say 3 months into the year. Then do we have them fill out a whole new form reflecting that they're Head Start? Because then
No.
they would go into a free category.
Yes. So as you will, just as long as you're maintaining your monthly list of Head Start, that's how we will verify, okay, this child did qualify for these months for Head Start. So we would look and say, okay, you claimed them as free for these months. They're on this list. That's good. They were determined as reduced before, and you claimed them as such for those
Okay.
other months. So they wouldn't need to fill out a new form.
Okay.
And then if you're not already doing it, a recommendation I would have for, if there's two kiddos listed and one is Head Start and one isn't, to just kind of add a note in there, especially when you determine on the back that Johnny is Head Start equals free, Susie is over income equals paid. And then that just little notes like that are always really helpful when we come to review. That way, when we're looking through all your papers, we can kind of see your thought process.
Okay.
And it kind of helps us. Okay, yeah, Lori did great. She knew exactly what she was doing on this, and then we don't have to ask any questions about
Okay.
that.
Sounds good.
Great
Thank
question.
you.
You're so welcome. Okay, let's see. I'm gonna end this poll and share. Okay. So there are two correct answers for this. You could determine this as paid. However, you could also, before you sign it, give it back to the family and have them update the form so that you can properly determine it. So what is missing is the income frequency. So they would either need to update that or you would have to just claim them in the paid category. Any questions on this IEF? Okay, we see this kind of a lot. Alrighty, we are going to go through our next. Oops, hold on. Our next one is IEF number 2 here. So again, same question. How should this one be determined? Free, reduced, paid, not enough information, or unsure? And so for this one, we have two kiddos listed with their enrollment information. There is numbers listed in the case number box, and they skipped step 3. All right, so I'll give you guys a couple minutes here. All right, I'm gonna go ahead and end this. Okay. So this one, the case number listed on the form is invalid. This is not a accurate SNAP, TANF, or FDPIR number because those are a 7-digit that starts with 1B. And so this would either need to be determined as paid, or you can give the form back to the family and ask them to update this case number. So if you said paid or not enough information, those were correct answers. Any questions? Okay. All right. Number 3. How should this IEF be determined? We have Jack and Jill on the hill. Enrollment information, no case number. That's all right. We can look at step 3. And then we have 2 adults. We have income and we have income frequency listed here. I have no idea how you manage. Whoever wrote on the slide is really cool. I have no idea how you did that. Um, hmm. We're just gonna wait and see if it goes away when I change slides. All right, got about half of you to answer. I'm gonna end this and share. Okay, great. It just does disappear. Fabulous. Okay, so this IEF did not have a last 4 digits of their social listed, and the box that says no social was not checked. So this would be determined as paid unless it was before you signed this and you had the parents update it. So again, this is where I would recommend highlighting that section so it really catches your eye and their eye. Because if it's claimed as free or reduced, if it doesn't qualify for that, we will need to adjust all of your claims for the whole fiscal year. All right. I have
a quick question.
Yes.
This might be redundant.
That's okay.
When I get the IEF back, I usually look at it and I'll circle the sections that the parents missed.
Yeah.
And hand it back. Is it okay I do those circles?
Yeah, absolutely.
Okay. Okay.
Fabulous. Whatever it takes to get the information from the parents.
Yeah, because I'll just circle it to kind of like remind me and remind them when I return it back. Why did I return this?
Yeah.
Yeah. Okay. Perfect. Thank you.
Great idea. Thank you. All right. We have one more here, and this is an adult daycare form. Alrighty, so how should this one be determined? So we have Ron McDonald here, and he has a Medicaid number listed. And the adult form does follow along similarly with the child form, where if there is a case number listed, they do not have to list the income. They can skip part 3. All right, let's see. A couple more answers coming in, so I'll give you a couple more seconds here. Awesome. 64% of you got it correct. So this would be determined as free. This is complete and correct. The Medicaid number qualifies Ron for free meals. So great job with that. Any additional questions on IEFs? If you ever have questions, please don't hesitate to reach out to your nutrition consultant. You can email or text us a picture of it. Because sometimes parents write funky things on there and you're like, what do I do? It's always an option and always beneficial to reach out and let us help you. Alrighty. So we are going to switch presenters here.
Really? The question in the chat box if you're willing. Yes, Kelly.
Oh. Oh. If the family does not, here, I'm going to go back a couple slides to answer that question, maybe.
The slides had the household numbers marked. So that's.
Yes, you're correct. If they leave that blank, you can add it. Or when you determine it on the back, you can just use the number 4. But it is required. However, if it's missing, it's not one of those kind of make or break pieces of information. Is that helpful? Does that answer? Okay, fabulous. Okay, all right. We are going to switch to record keeping part 2.
Okay, so I'm going to take over here. So we're going to talk about sign-in, sign-outs, civil rights, training records, and more. So in this section, we'll cover the monthly roster, sign-in, sign-out records, 5-day reconciliation, ROMs, claims and reimbursement, receipts, training, and enrollment records. So first, we have the monthly or master roster. And this is a form that lists the child's first and last name and IF eligibility status. You can update it when children enroll or withdraw. And you can verify the accuracy monthly to ensure claim accuracy. And it also keeps track of IF expiration dates, which is very helpful. And then time in, time out records are required by CACFP and CDEC. The parents and guardians must sign all children in and out daily. CDEC regulations are that it's a full signature, not just initials. And the staff can sign children in and out that are transported to and from school, such as on the bus. And then attendance records are required for emergency or homeless shelters, adult daycares, and after school at-risk programs. So during your review, nutrition consultants will verify 5 consecutive claiming days by completing a 5-day reconciliation. So we'll compare the ROMs or the meal counts to the total number of participants in attendance to ensure claiming accuracy. So now we're going to talk about ROMs. ROMs must be completed by visual observation at the time of meal service. Only mark a child on the ROMs in the room where they ate and are observed. Eligibility should not be on the ROMs until you're preparing the claim. First and last names on the ROMs must match names on the IEFs. So again, no nicknames. And you can keep ROMs in each classroom. And only mark children who begin their meal or snack within the contracted meal or snack times in your application. So if you need to update those, then please update those. So this is an example of our ROMs sheet that we have available for you to use, and we're going to dive into it a little deeper into all of the sections. And you can use electronic ROMs. Again, they must be marked by the staff in each classroom during the meal service. It can be helpful to compare the electronic records with the classroom ROMs to ensure accuracy. And make sure that your system does not allow for more than 2 meals and 1 snack to be claimed for each child daily. And automatic meal counts based on sign-in, sign-out records is not allowed. So I saw a question in the chat box really quick about the 5-day reconciliation. If it should be right before the site visit date. And when we come on site, we will based on the month that we're looking at records for, we will choose those dates. I know that Randy, you are a sponsor of centers. So for you, it's a little different. We will look at records based on your or monitoring visits that you did your site visits for. Okay, so now we're going to dive into a completed ROMs or a semi-completed ROMs, and we're going to complete the rest. So on the ROMs, you can see that all of the names of the children are listed, and they have X's for all the meals and snacks that they ate during the week. And then they do have the codes filled in. So this is us basically completing a ROMs for our monthly claim information. So first, we're going to start off with the top section there, which is number of participants who ate at least one meal or snack during the day. And so in order to get this number, we'll look at Monday and we'll basically go down each line and see how many children ate at least one meal or snack during the day. So if you see an X, then you count that line. And on Monday, we have 13 kiddos that ate at least one meal or snack. So we put that in the top box there. And then you'll continue that for each day of the week. And then you'll get a total at the end of the week. And then when you're entering your claims, you'll add up all of those totals for the month, and it will be used as your total attendance when you're entering claims. So moving on to the next section, we recommend that you highlight each eligibility category in a different color prior to counting. So then it's easier to see your free, reduced, and paid students, and it won't be as confusing. So then the section on the bottom there, we're going to go through and count the number of free breakfasts, and then count the number of reduced breakfasts, and count the number of paid breakfasts. And you can really see how the highlighting helps. And then you'll repeat that for each meal and snack type, and repeat it for each day. So you can see that bottom section is all filled out now. And then the section on the very bottom of the sheet, you'll use to calculate the weekly total meals served in each category for each meal or snack type. So first we'll add up the free breakfasts, which you can see there equals 36 free breakfasts. And then we'll add up the reduced breakfasts, which was 11 for that week, and the paid breakfast, which was 6 for that week. And then you'll continue that for the rest of the meals and snacks as well. And then for ROMs for Head Start participants, they are not a part of the free category under childcare. So Head Start meal counts have a separate section when you're submitting claims. So you can use either 2 sets of ROMs, or we do have a special template that splits out Head Start kiddos and childcare kiddos. So then on the very bottom of the ROMs form, you'll see a section for staff meals. So you cannot claim staff meals for reimbursement, but you can serve meals to staff when they're prepared, that are prepared with CACFP funds. You must document the staff meals. This is used when we're calculating adequate quantities of food are purchased. Okay, we're going to do a little ROMs quiz. You can unmute yourself or answer in the chat box. So the meal service time for your site is 8:30 a.m. to 9:15 a.m. A child arrives at 9:25 a.m. after a doctor's appointment and is hungry. You serve them breakfast and mark them on the ROMs as normal. What went wrong and how should this scenario have been handled correctly?
This is Risa from Elder House Adult Day Program, and we transport our folks by our buses, and occasionally when they're late, we do go ahead and serve breakfast. However, we don't count them for the claim.
That's correct. Yep. Yeah, we definitely encourage you to still serve them food, but yeah, you cannot mark them on the ROMs to include them in the claim. Correct. Yep, I see a lot of correct answers in the chat box too. Good job. Okay. The second question is, your institution serves a meal to all adults that sign in for the day. So at the end of each day, you mark the ROMs based on the sign-in list. What went wrong and how should this scenario have been handled correctly?
I have a quick question about this quiz. Is this for a childcare or for an adult day center?
It can be either. This question can kind of be for either. It can be for childcare or adult. Yep, I see a correct answer in the chat box to only mark the ROMs as you observe each person having the meal, not at the end of the day based on the sign-in list. Correct. I see a lot of good answers coming in. Okay, moving on to the next one. A child is transitioning from the toddler 1 to toddler 2 classroom. The child had breakfast and lunch in toddler 1 and is in toddler 2 for PM snack. The PM snack was documented for them in both classrooms. What went wrong and how should this scenario have been handled correctly?
So I have a question. Does this count for sorry.
Of course.
Does this, some of these questions, I work at a homeless shelter, and a lot of these questions don't even participate because we're kind of under a different program. Am I correct?
You are correct. Homeless shelters have some different record keeping requirements. Yes, so most of these are geared towards childcare and adult daycare. So yes, you are correct.
Okay, thank you very much.
Yeah. Yep, I see some good answers in the chat box that the child should be recorded in the room they're eating in. Awesome. Good job.
Can I ask a question about that?
Yes.
So our ROMs go in alphabetical order, and if we by last name, but this means we might tag on a child the bottom not in alphabetical order. Is that okay?
That's okay. We see that happen a lot. Just, you know, when you make your ROMs for the next week, try to add them in alphabetical order. It just makes it a little easier for record keeping. But yeah, we understand that, you know, kiddos can come and, you know, come in the middle of a week or something, and you just have to add them onto that ROM. So that's perfectly fine.
Thank you.
Of course. Okay. Your institution is understaffed, so to save time, you list all participants on the ROMs by their first name only and use nicknames as much as possible. What went wrong? How should the scenario have been handled correctly? Yep, the names must match the IEF and no nicknames. We want their full names on the ROMs as well as the IEFs. Awesome job, guys. Okay. Another question here. You allow your staff to enjoy meals while sitting with the participants to model healthy behavior and eating habits. You know that staff meals cannot be claimed on your CACFP claims for reimbursement, so you do not document the meals served to teachers on the classroom ROMs. What went wrong? How should this scenario have been handled correctly? Yep, staff must be entered in the staff section of the ROMs. So you still want to document that they ate the meals. It just doesn't count towards reimbursement. Correct. See a lot of correct answers coming in. Good job. Okay. Any more questions about ROMs before we move on to other record keeping? Okay. We're going to move on to enrollment verification. We talked about this a little bit in the beginning, but we're going to go a little more in depth. So enrollment records are required for each enrolled participant, which includes children and adult receiving meals while in care. They must be updated annually. They must include the parent or guardian's signature and date. And meals are not eligible to be claimed when a participant has an expired or missing enrollment form. If we do find this during a review, then the ineligible meals will be disallowed. So enrollment forms need to have two pieces of information, which are the normal days and times of care, and the normal meals or snacks received in care. And we do have three options available for the enrollment documentation, which is on the income eligibility form in that top section. We do have a CACFP enrollment form template. We have one available for children and one for adult. And then you can also use your own form as long as it has the required information. And you'll just want to send that to a nutrition consultant to get it approved. So again, we showed you this earlier. One of the options for enrollment is documenting it using the income eligibility form on that top section. And then this is our childcare enrollment form template. And it includes space for 2 additional annual updates if no information has changed. So one form can be valid for a total of 3 years. You just have to have them sign and date it annually. And then this is our adult daycare enrollment form. And this also includes space for 2 additional annual updates if no information has changed. Okay, now we're going to move on to what's in a claim. So the following information is required to submit an accurate claim. We have total days of operation, total attendance, number of enrolled participants in each category, and total meals or snacks served by meal type. So this is a little snapshot of the claim area in CNP. And so first we have the total days of operation, which is the number of days during the month that the site was open and serving meals. Then below that, we have total attendance, which is the sum of attendance for all days of operation for the month. Again, we get that from the top box on those ROMs, adding those all up for the month. And then the average daily attendance gets automatically calculated based on those numbers. And then in the number of enrolled participants in each reimbursement category, you'll just enter that for each month. Then if you are a for-profit center, there is this other section that needs to be filled out. The license capacity, this automatically generates from the site application. So if your license capacity changes, please update that. And then there's also the free or reduced eligibility. I don't see the presentation anymore.
Did we lose Natalie? She's still on the call. Oh, there she is.
Okay, perfect. Thank you. So the free reduced eligibility, this is automatically generated from the information you entered in C5 through C7. And then there's also the number of Title XX or CCAP, where you enter the number of participants who are beneficiaries of CCAP funding and in attendance at least once during the claim month. And adult daycares will enter Medicaid information there. So then in the claim, you'll use the ROMs to calculate the total number of creditable meals and snacks served for each meal and snack type. And you'll report this meal and snack counts separately for each income eligibility category in the columns A, B, and C. And the total number of each meal or snack served will be automatically calculated for you. So for at-risk meal counts, it does look a little different. So you'll see the total days of operation there, which is the same, the number of days during the month that the site was open and serving meals. Then you'll see number of enrolled, and you'll enter the highest number of participants served in one day during the claim month. And then there will be the total attendance, which is the sum of the attendance for all days of operation for the month. And then you have the meals and snacks served, which you can use the ROMs to calculate the total number of credible meals and snacks served. So at risk, all of the kiddos are in the free category. So that's why there's not those different eligibility sections. And then if you are part of a Head Start program, things also look a little different. Again, Head Start kiddos are automatically claimed as free. So first you have the total days of operation, the total attendance, and then you'll have the meals and snacks served where you use the ROMs to calculate the total number of meals. Any questions on any of that before I hand it over to Alicia?
I have a question. Sorry if there's background noise. Ours, whenever I enter that information, it auto calculates some of the cash in lieu. Is that just based on our contract somehow, or how can I validate? I just wanted to make sure I wasn't accidentally getting the wrong information in there.
Yeah. So cash in lieu is based on your application. And so that's when you're not receiving USDA. I can't think of the word. If anyone wants to hop in.
Reimbursement?
Commodities.
Commodities. There we go. Yeah. So if you're not receiving USDA commodities, then you're receiving cash in lieu, which is an extra amount on lunch and supper. Okay. So yeah, that's nothing that you enter in there. It's based on your application.
Okay. I just wanted to validate because I was like, I swear I'm not entering anything anywhere else. And it always shows up. And I'm like, what did I do? Okay.
No problem.
And then I had one more question. I think that was sort of in this specific area. We wanted to purchase like kid-sized pitchers so they can pour their own milk.
Yep.
Is that a kitchen supply that we could put against the reimbursements, or is that more than like plates and silverware, etc.?
You could definitely, since that's like a serving tool, you could definitely use your reimbursement to pay for that.
Okay.
Yep.
Thank you.
Of course. Any other questions before we move on? Okay, I'll pass it on to Alicia.
Hi.
I did have one
Good.
more question. I'm so sorry, Alicia. We had on our enrollment, the CACFP enrollment form where you show Monday, Tuesday, Wednesday markings or whatever. The second page of the non-discrimination statement was on the second page. And my staff were told to upload the enrollment form and get rid of the rest of the packet. And we didn't realize that that was on the second page, not with the signature. Is that an issue? Do I need to go reattach that in our files, or can I show in our enrollment packet that that does go to them when we enroll them?
I would say just moving forward, make sure that you have that.
Okay.
Yeah.
Okay. Because I do have proof that it gets handed out in the packet. It just didn't get. Okay. Okay, that's mine. Thank you.
Hey, Emily, I just realized who you are. You're with CLCP, correct? Yeah, nice to meet you and welcome aboard. I know that you're new to your role, so thank you for asking so many great questions. Okay, so yeah, I'm going to cover some program information for all of you. This will include claims, training, civil rights, and a couple of extra tidbits. So claims for reimbursement. All CACFP claims are submitted online through the Colorado Nutrition Portal. Once you apply and are approved for the program, we will set you up with a username and a login. Each person who has responsibility for claiming or anything that has to do with the CACFP application will need to have their own account, their own username and login. There is no sharing allowed. And we do ask and we emphasize that you do not claim for more than 1 month at a time. So we do ask that you ensure accurate claims, monthly claims for reimbursement. And just to kind of reemphasize that reimbursement is not allowed for meals or snacks that are served to a child or to an adult who is not in care, served in an excess of licensed or authorized capacity. They're not allowed for not approved if you're not approved in the agreement. Also, reimbursement is not allowed for meals or snacks served in excess of the amount of number of approved meal services. Or if the institution is out of compliance with meal pattern requirements. And you have once you submit the claim, CDPHE and CACFP, we have 45 days to process your claims. I think the claims usually are processed a little bit quicker than that, but there is a 45-day threshold there. Next slide. So here are some tips. Oh, I'm on the wrong slide. Looks like, okay, there we go. So here are some tips for entering claims. You want to maintain separate monthly ROMs for each classroom. You could use a highlighter to highlight eligibility categories with different colors so that when you're submitting claims for different income categories, your eye can follow the different colors. You want to compare your ROMs to your time in and time out records to ensure your child is in care, the children are in care. You want to make sure that you are not claiming for children who are not signed in or out for that day, even if on the ROMs. So you want to compare your children's eligibility category on the ROMs to your master roster as well to ensure accuracy. So those are just some edit checks that you can do on your end to make sure that you are submitting the correct numbers for your claims. So this is a resource that we share with our institutions. It's a claim due date resource. You'll see your claim month in one column, and then you'll see when that claim for that month is due. So you do have 60 days to submit a claim for a month. All claims must be filed online within 60 calendar days from the last day of the claim month. And one more time, we have CACFP has 45 days to process your claims. So here we have your reimbursement rates. These are determined by USDA. They are effective. The rates are effective from July 1 through June 30th. You will receive correspondence from the state agency from our office every year, usually around this time, maybe a little bit before, with the updated and most current reimbursement rates. And your site's reimbursement is based on your complete and accurate IEFs. So you see the free, reduced, and the paid. So CACFP state training is available online. You are all participating in the live Zoom state training. We also offer self-paced trainings on CoTrain. And then we are so happy to be able to offer in-person Denver Metro and regional options as well. All that information has been shared with you, and we will continue to share in-person and online training information as we move through the year. So training is required when joining the CACFP, and we highly recommend it to be completed annually to stay up to date on all current regulations. We ask that at least one staff member overseeing CACFP operations complete the training so that you then can go back to your other staff and offer the annual training, the staff that have CACFP duties, that is. Okay, so the annual training. So all other staff members with CACFP duties must be trained annually by the person who completed this training, the state training. You will see that the trainings do need to be documented. This resource it's in the chat box, but it's also available online on our website. If you choose to document your annual CACFP training on your own on a different form, just be sure to include the following information: names of all attendees, the date of the training, all the topics covered, and the name of the trainer. And we do ask that the training, well, it must include, and it's required that you also include and train on the annual civil rights training. So just as best practice, it's best to use our template. It covers everything. Okay. So a little bit on civil rights training. Here is a template that we provide. It is required annually. All of these training materials, the civil rights training materials and the annual CACFP training materials, can be found on our website in multiple languages. And training documentation must be kept on file for both. So we're going to review the civil rights requirements a bit more. These are the same requirements as all are for other CACFP institutions. We're going to go over some specific areas of compliance that tend to result in errors for participating with the CACFP. So this is the And Justice for All poster. We require that it's displayed at all participating institutions and must be in an area that's visible to participants. The most current poster has a green USDA building on it. If your center has a sign that has a Statue of Liberty, please email your nutrition consultant or the CACFP main email address and request an updated poster to be mailed to you. So I'm not sure. Oh, okay, we're moving on. Moving on to the next slide.
Do you need me to go back?
Oh, I was just going to mention, do we allow our institutions to print the poster? Okay, so
yeah.
Okay, I guess I don't always encourage that because we are willing to send you a laminated copy. But if you do print your own, you have to ensure that it is 11 by 17 inches. Okay, thanks, Natalie.
Of course.
So additional civil rights requirements. Let's see. So the ethnic and racial data, both ethnic and racial data for actual enrolled participants are required each year. For recertification, this information is captured in your application. So you just need to ensure each year at recertification that these numbers are correct. It may be collected on your IEFs as well. So you'll see on the back of your form, the parents or guardian can also mark the ethnic and racial data, and visual observation by staff is not allowed. So the non-discrimination policy statement, this is required on CACFP related documents except your menus. It is available in multiple language, and if size of material is too small, you may request to use a shortened statement. But if you would like to use the shortened statement on any of your materials that are CACFP related, you will need to obtain approval from the CACFP prior to using the statement. So limited English proficiency. We offer program information in several different languages, and this is all available on our website. Okay, so when should you get a hold of us? So if your center is bought, sold, or the ownership changes, we will need to know that immediately. If the responsible CACFP center staff changes, particularly the program contact, that person is who we correspond with the most about anything current or anything changing with our program. So you'll want to let us know when that person changes. When your site changes address or moves temporarily or permanently. When a site closes or no longer wants to claim meals, again, temporarily or permanently, you'll need to get a hold of your nutrition consultant for that. And then when staff leave who use the CACFP online system, so the Colorado Nutrition Portal, when a staff member is no longer employed at your center, but they are in charge of receiving correspondence or responding to us, we need to know when that person is no longer with you. Okay, so CACFP state compliance reviews. These are scheduled every 2 to 3 years, depending on your site type. Large sponsors, those that have 10 plus sites, church organizations, emergency shelters, and food banks, you get to see us every 2 years. So we are required to follow up if a complaint is received. You will hear from us then. And when we review your program operations, we will be looking at your IEFs, your menus, your ROMs, your attendance records, enrollments, receipts, labor records, and we will conduct a meal observation while we're on site. We will do our best to notify you at least 3 weeks prior to a specific data visit. We do our best to correspond or reach out to our institutions that are up for review. We try to do that like pretty early on, just to give you a heads up that we'll be visiting you at some point in the fiscal year. And then you get like official correspondence from us right before your review starts. So we will be looking at documents for 1 month's claim, and we may request to look at all your documents from the fiscal year, starting back in October. So here's some additional CACFP requirements. It is required that you provide WIC information to all your families of enrolled children. We ask that you use the most current information regarding the benefits and eligibility of the WIC program. If you need some of those resources, we can help you with that now. Chrissy just put a WIC flyer in the chat box for you. You can print that out and post that in an area that is visible to your families. And then all licensed childcare facilities that do not hold a Colorado retail food establishment license must post a hand washing poster in employees' bathroom and at sinks, the sinks that are used for hand washing during food handling. And we are also sharing that poster with you in the chat box. So a little bit on food safety. Excuse me. CACFP providers serve serve meals to members of high-risk population. Members of high-risk population or high people are more likely than other people in the general population to experience foodborne illness. So that includes people with weakened immune systems, such as children, adults over 65, and pregnant women. Staff members assigned to specific groups of adults who use diapers may not prepare food for adults or children outside of their assigned group. And staff cannot be involved in the care of adults or children and food preparation at the time if there is a risk of contamination of food by bodily fluids. So here's a list of so foodborne illness is defined as disease caused by consuming contaminated food or beverages. Contamination can be caused by bacteria, parasites, viruses, chemicals, poisons, or toxins. And so the CDC and the FDA conducted a study. They reviewed all FBI outbreak data over the past 10 years and determined there were 5 primary causes of foodborne illnesses. So the first one is poor personal hygiene, improper holding temperatures, inadequate cooking, contaminated equipment, and food from unsafe sources. We like to include some common foodborne illnesses. There are many out there, but these are some common ones that we like to put a spotlight on. So the illness was caused by the last meal or food eaten. Foodborne illness is only caused by food that has gone bad. All foodborne illnesses are the same, and I've never made anyone sick, and it's not important to report to the health department. So we have some food safety training resources for you. The training for food handlers is highly recommended. And you'll see below there's some options that you could utilize, such as a low-cost in-person training through your local health department. ServeSafe is a company that offers classroom and online trainings. And then we have estateFoodSafety.com, which is an online training which costs $10 and it's offered in multiple languages. Awesome. Okay, so let's review a little about menus, production records, receipts, and meal service. So menu documentation requirements and recommendations. So your menus must include dates. And we want you to display your menu where your participants and guardians can see them. On your menu, we will look for substitutions. So you'll need to post all substitutions on your menu. Ensure that all meal components are listed out, written out by name. You want to follow the meal pattern that the CACFP meal pattern so that you can ensure that you're serving creditable meals. And you can create multiple weeks of menus at a time. We love to see creativity when it comes to your menu and meal planning. We encourage it, and we also have a lot of resources to help you if you kind of get stuck with the meal planning process. So here is the CACFP template, menu template. As you can see, it's a week at a time. So it's Monday through Friday. Then it has breakfast, lunch, and snacks. So there's your meal type. And then within it, it has all of the components within each meal type. There's also some great information at the bottom as well. It's okay. Okay, so production records are great resources to use to help your staff plan with how much food to purchase and how much to prepare. These production records, our production records are optional, except for infants and what was the second one? I drawing a blank. Adults.
Vended meals.
Vended meals. Thank you so much. Yes, we're going to dive a little bit deeper into production records in the next few slides. So here's the CACFP child menu and production record template for ages 3 through 5. You'll see that the meal type is listed out along with the portion size. And then there's some math to be estimated to help you estimate the number of meals served for your children and adults. It looks like this has all of them on there. Okay. So institutions that choose to not use production records, you must still maintain a daily record indicating the number of meal by type served to adults performing labor necessary to the food service. The format on how you do this can vary, and we can show you I think we have a ROM that has a little section that allows you to indicate if adults are eating meals. Okay, so food service management contracts. Production records must be available from your contractor or vendor. So your food service vendor must keep production records. We also ask that they offer delivery slips and that these delivery slips are signed daily and kept on file. We also ask that they are organized and keep their CN labels, nutrition fact labels, and the recipes that they use to make your meals. We will look at all of those during the review. Okie doke. So here's a little quiz, and you can just pop the answer in the chat box. Production records are optional, except in these two circumstances. And it looks like Natalie gave you a couple of hints. Does anyone want to take a stab at answering this? Okay. So production records are optional except for infants and for your vendor. So infant meals require that you have a production record for each infant. And then for your vended meals, your vendor must also keep production records.
I'm sorry, I have a question really quick. We're talking about infants up to 12 months. After 12 months, they don't need production records.
Yes, once they have their first birthday, they can
So
just
even
be
if they're in the infant room, but they had their birthday, then they no longer need the production records.
correct. Yep, they can
Perfect.
just be
Thank you.
documented on the ROMs.
Perfect.
Yeah,
Just making sure. Thank you.
you're welcome.
Question. Okay, so receipts and invoices. So having documentation of all receipts for CACFP items is required. The receipt must show the food and milk that was purchased, the total of the receipt, and the date that the items were purchased. You must keep CACFP items separate on the receipt from other items purchased for your institution. For example, if you purchase coffee or coffee creamer, candy bars, cupcakes, art supplies for your classrooms, those are not allowable items for the CACFP reimbursement. So we ask that you separate them out on the receipt or indicate somewhere on the receipt that they are not CACFP purchases. If you are unable to keep these items separate on your receipt, then please subtotal the CACFP items and highlight them just so that we can clearly see which purchases are belong where. Okay, thank you. So donations are allowed. And if you receive a donation, you will need to document the donation. We have a form and we will share that with you now. It's really straightforward. It asks for all of the required information. And we just ask that you document these and keep them on file. So types of meals served. We have pre-plated meals for meal service. You serve all foods in required portions to each participant. This is usually done either by the classroom staff or the kitchen staff. You pour the entire portion of milk at once for your children or your adults, and participants do not have a choice in the food or the amount that is served to them. We also have the offer versus serve option for adults and at risk only. It's not allowed at snacks, however. And then we also have family style meal service. And we're going to focus a little bit more on family style meal service. So these are some benefits to the child. Really great benefits. It increases their social skills. It helps them branch out on their food options. They start to learn about portion size. It improves their intake of food because they have some choice in the matter. It also encourages them trying new foods, another benefit of giving them a choice. They learn satiate. I always get this word wrong. I can say it like satiated, help me out, somebody. And it reduces the obesity risk at all as well.
Satiety.
Satiety. Thank you so much. Okay. So benefits to your provider. So you get to spend more time with your children. It's an amazing opportunity to sit down and get to know the children. You know that some of the best conversations happen around mealtime at the table. You spend less time serving. So you get to allow them to have that control and that the option to do that. Role modeling, it gives you an opportunity to role model your own healthy eating habits, and you have a quieter mealtime as well. It reduces control issues, and there's less food fights, less food arguments. So how can you plan for success for a family style meal service? So you start by putting all the foods on the table at the start. In the required amounts. You use child-size friendly serving bowls, utensils, and pitchers. So you want to set your children up for success. You don't want them to be intimidated with the food in front of them. You plan menus for your family style, for example, like penne versus spaghetti. And you can practice with snacks first. Start small and then move on to your larger meal service. And you just kind of go in with the mindset that there will be spills, that children are learning, and that's actually how they learn best, is through making mistakes. So we like to encourage the use of local foods with the CACFP. Get to know your local farm stand, your local farmers market, or who and how you can participate in a CSA. You'll want to maintain receipts the same way for local foods as you do with all other CACFP purchases. And donations from local gardens or farms are allowed. So that's a really cool thing to think about. And CACFP funds are allowed to purchase items to grow in a garden on your site. So just a little bit about using food or beverage as a reward or punishment. This is prohibited in centers and in family child care homes. It is prohibited for the very obvious negative effect that it has on development and socialization. And rewards tend to lead to negative consequences for your participant. And punishment with food could cause overeating over time. So if you're interested in some quality improvement support, the Colorado Shines rating level, you can increase that level by participating with the CACFP. You can ask questions here. Chrissy just put some information on Colorado Shines in the chat box. You can also get a hold of your early childhood council. They are a wealth of knowledge, and they can help you with some more individualized support for your program. So I think it's my turn to hand it back over to Natalie. She's going to wrap up the training for you all, but thank you.
Thank you, Alicia, and thank you, Ari, for both of y'all's presentation today. So I'm actually going to skip this slide and come back to it. I'm going to stop sharing my screen just for a minute. So, stop sharing. Okay. Because I'm going to pull up our website and walk everybody through that. And then I'm also going to do, okay. Alrighty, if y'all could just be so kind and give me a thumbs up if you can see the Colorado Food Program website. Okay, awesome, thank you. Alrighty, so as I mentioned earlier, we do have a new name and logo and look, and we also have this fun little video. It's only about a minute long. It kind of is just a super brief explanation of what the food program is. So if you want to include that on your website or share it with families that are interested about what the Colorado Food Program is, it's a great new little resource we have. So our website has been receiving a lot of love and updates lately. So I'm going to do a little tour and show you how to find all of the resources we have on here. And before I forget, I saw a couple comments in the chat box that not all of the links were working. So I am going to send those out in an email as well. So hopefully they're working then, and if not, just reach out to me directly and let me know if any of those links aren't working. Okay, so this is the homepage. There's a link right here that will take you straight to the Colorado Nutrition Portal, also known as CNP, which is where you update your application and submit claims for reimbursement. We also have our claim due dates here. And then on this side, on this left side, are all these different pages. So our contact information is here on this first tab. And then we have specific tabs for different types of programs. I'm going to take you to our training page. So this calendar has all of our currently scheduled trainings. So for example, this was today's. So it has the registration link and everything on here. If you are not registered for Thursday's training on meal patterns, you may go here and register. You can also click through the arrows at the top to click through the different months. In February, we're going to do a training on feeding infants in the CACFP, and we're going to walk through individualized production records for them and all requirements for infants. Registration link is available on the calendar there. And then in March, we're going to have another, infants is virtual. And then we're going to do a Sponsors of Centers virtual training as well. And then fingers crossed, the weather's going to cooperate for us to start hosting our in-person trainings again. So we are going to have one in Denver, March 27th. You can go ahead and register for that. April, we are going to be traveling to Pueblo and Greeley. May, we're going to be in Durango. June, we are back in Denver. We are giving ourselves the month of July off for the first time in many, many years. It's so hard to schedule in July. And then August, we don't have the date finalized yet, but we will be in Grand Junction in August. And then back, I don't have it on the calendar yet. Then we will be back in Denver in September. So lots of options coming up. Please register. Even if you're not 100% sure if you can attend or not, you can always just register. That way you have the information. And then you can also click this link here that says the training information and opportunities. And so this gives you kind of all the training information that you're going to need for the entire fiscal year. So the very first thing here is our what to expect during a review information. So if you're getting a review this year, if you didn't attend our live Zoom on what to expect, you may watch the recording here. There's also a checklist with links to all of the resources that you would need to get ready for a review. These are our upcoming virtual sessions that I also just walked through on the calendar. This is our in-person training sessions. Again, same information, just a different format. This is kind of like a one-stop shop. These are some previously recorded Zoom training sessions. It's the same information we talked about today. This is just broken out into 5 sections instead of like this week, we're having 2 bigger sessions. We have a recording from our adult daycare training that we did. And then this is the information for our online learning modules. So these are self-paced and you can access them 24/7, 365 days a year. So this is really great if you have new staff that, you know, it's going to be a while before they can attend in person, or you just want a refresher. The meal pattern training is available in English, Spanish, Russian, and Arabic. And then we have these supplemental training videos. So these are some more topic specific, more in-depth training. These are previously recorded live trainings. These currently do not give you a certificate, but it is really helpful information. So we have one on the financial impacts of income eligibility forms, one on calculating grain ounce equivalents, one on feeding infants, and one on fiscal training requirements. Or sorry, fiscal record keeping requirements. Our modules are also on PDIS, which is the Colorado Shines Professional Development Information Center. So that's there as well. We do have some new training videos that we're going to be releasing this spring, probably March is our current plan. So they're about 10-minute long videos on specific topics. And they're very much in the style of the video that's new on our website. So it's animated, it's colorful, it's interactive. And we focus these videos on topics that we usually see a lot of non-compliance in and results in institutions paying money back. So we're excited to be launching those. And then this is links to kind of our most important resources. Scroll all through there. And then finally, my direct contact information if you have any other training questions. So all of that lives right here in this link, which is on our website in the training page. A lot of it is also listed down in here as well. All right, so now I'm going to walk you all through the materials and forms tab. So these are broken out into center types. So all of these forms are for adult daycare centers. So this is our income eligibility forms and letters in all the different languages available. The next section is the same for childcare centers. And then finally, family childcare home. If you scroll down, you can open all of these up. This section is the special diet statement forms and milk substitute forms, both in English and Spanish, as well as our form for adult daycare centers. This is information on your compliance reviews. This is information if you're sponsors of centers, your site visit forms. This is all the menu templates we have available. We have some that are 5-day, some that are 7-day, with any combination of meal or snack that you could think of. And then this is all the production records for adults, children, and infants. This is our records of meals served. This one that says with staff meals, that's the one that has the yellow bar along the bottom where you can document teachers or other adults that are eating. And then this is more templates, our adult daycare center enrollment form, child nutrition label guide, the donated foods receipt we shared earlier is on here. Handbooks. All right, so that's the end of materials and forms. Now I'm going to show you the meal pattern page. So this is some of our most used meal pattern resources. Whole grains, grain-based desserts, cereal, yogurt. And then we also have infant resources, child resources, and adult resources kind of broken out individually. This is the civil rights information we shared earlier. Anything you need is in here. Let me see if this link works. Oh, okay. So probably with some of the website updates, this link is broken. So I will make sure that we get working on that. Let's see. Like this is the template for documenting your annual staff training. The page that is about the Colorado Nutrition Portal has our instructions for submitting a claim. And finally, the Healthier Meals Initiative page has some additional resources, particularly on processed meats. And this was recently translated into Spanish as well. And it just has, it's a great visual. So we'll go more in depth on processed meat and meal pattern requirements on Thursday. Any questions about the website before I show you all the Colorado Nutrition Portal a little bit? Or like how to register for training or anything like that? Any Any questions? Okay, if you can't find something, just email us. Sometimes we have a hard time finding stuff on the website too, because it gets put in a new folder. And so just let us know if you can't find anything. Okay, I'm going to open CNP and show you all. So if you go into, let me make this a little bigger for you. There you go. If you go into applications and then go to download forms, and I'm gonna make it smaller. This is where a lot of documents that used to live on the website now live. There was a new bill passed to make all documents that are accessible to the public digitally accessible, meaning that a screen reader can accurately read the document as needed. Doing digital accessibility is very time consuming, and so not all of our documents have been updated for that yet. And so that's why they live here, because they're not accessible to the public. You have to have a login. So again, if you're looking for something, you can't find it on the website, check here in the download forms section. And these are, again, kind of broken out by category. So we have fiscal documents here. And then we have all the different budget templates for any type of center. If you are up for a review and you want to see the checklist, those are here for variety of program types, family child care home documents, and then all of the income eligibility forms in all the languages, adults, children, the letters, it's all in here. Infant forms, management plans if you're a sponsor of centers, all of our manuals, so our child care manual, adult daycare manual, all of our, kind of 101 guides to all things CACFP live here. Menu and production record templates, ROMs, our most updated site visit forms are in here as well. Any additional sponsors of centers documents, and then training documentation. Including, this is one that I like to share too. This is a PowerPoint that you can use when training your staff at your center on CACFP requirements. Okay, any questions on that? I'm gonna go back to my PowerPoint. All right, you guys, is my PowerPoint back up? Okay, great. Yay, thank you. Awesome. Well, I kind of anticipated we might finish a little early today. So if nobody has any questions, we are going to wrap up. I do ask that you complete the post-test and evaluation survey. Once I have both of those back from you, I will send you your certificate for your training today. And I will also send you all the recording, all of the links. Again, if you haven't done so, please register for Thursday's training on meal patterns. And I'll stick around for a few more minutes if anyone has any other questions. Otherwise, enjoy the rest of your day and hope you all learned something. Thank you.
Bye, thank you.
Hi, sorry, I missed what we were supposed to do with the QR codes. Hi.
Hi. Yep. Sorry. I tried to unmute myself and it didn't click. I will take it back to the QR codes. Hang on one second. There we go. There also there's links in the chat box too that you can click on, and I'll send an email.
Okay, what are we supposed to do?
Oh, one is a post test. So it's the same questions that you answered in the pre-test. And
Uh-huh.
we'll use that to compare what you knew when you started the training today and what you learned at the end of it. And then the other one is an evaluation. So just for an opportunity for you to give us feedback so we can make our trainings better for next time.
Okay, has this been sent to our emails?
Not yet.
Will it be sent to our emails?
Yes.
Okay, so I didn't have to do the pre-test because I registered and I went to the link for my registration.
Okay, that's fine.
Okay, all right.
Okay,
Thank you
thank
very-
you.
Okay, bye-bye.
Bye-bye. All right. Any other questions before I close it out and kick everybody out?
I have a question.
Yes.
I just did the post test, but it says that it's anonymous. So how do you know?
Yes. So we don't track it like per person. It kind of tracks overall as a group.
Okay. All right. I just wanted to make sure I wasn't supposed to put my name somewhere.
No, you're fine. Thank you for asking though.
I had a question slash suggestion.
Sure.
We collect racial and ethnic data at enrollment. And so one of our options that is not an option for the CACFP is like biracial families. So we do have a lot of families that are biracial, and we don't know specifically like what two ethnicities or backgrounds they are. So it's always a little bit challenging to take our data and then, right, because we pull a report and then put it into the CACFP. I try to do it as close as possible, but it would be nice to have a biracial option.
Okay. That makes sense. I'm trying to think. Depending on your report and how you're trying to do the information, can you just select multiple races or ethnicities? Would it allow you? I'm not sure what the report would spit out to you, but if it says maybe two different ethnicities, you could always just check both boxes on our form.
Yeah, it's like not an option, so I don't know what the two are unless I know the family specifically or know the child specifically.
That makes sense. Okay. That's really interesting feedback. I appreciate it. And I will see if we can make that a little more all-inclusive. Of course. Thank you, Carla. Alrighty. Well, everyone stay warm. Hopefully you get a little sunshine in your day, and hopefully we will see you Thursday.